KRON 4's Dan Kerman reports on that.
A new study published in the journal Public Health Reports finds San Francisco's response to COVID-19 led to one of the lowest death rates overall and across all ages and ethnicities.
It really was a confluence of strong public health infrastructure, a strong city infrastructure, and a really informed and savvy populace who was ready to hear data, was ready to really respond in the ways that they could to reduce disease and death.
The study found as of 2022, San Francisco had the lowest number of COVID-19 deaths among large metropolitan cities in the U.S., with 98 per 100,000 residents, compared to 229 deaths in the state of California and 301 in the entire U.S. population. San Francisco Health Officer Dr. Susan Phillips says one key strategy was focusing first on frontline workers.
Early in the pandemic, a study by our UCSF colleagues that really showed that in the mission, it was the workers who weren't able to shelter in place, who were continuing to serve food, deliver things throughout the city, work on the front lines that were getting COVID and getting sick. And I think that really was an impetus to really reinforce that as soon as we had vaccines later in that year, as soon as we had other interventions like tests and masks and rooms for people to isolate, that we really needed to be paying attention to the people who were doing those frontline jobs. And that was incredibly important.
Politicians, community partners, and healthcare systems also came together to create mass COVID testing sites as well as neighborhood pop-ups.
What the public health authorities realized early on was that you really had to meet people where they were, whether or not that was the Latinx population in the mission or the African-American population in Bayview. All populations were really raised, and that was really illustrated by the data.
The report did find in some cases San Francisco's outreach could have been faster, and San Francisco General was stretched to the limits. But UCSF infectious disease specialist Dr. Peter Chin Hong says all of this is good information for whatever is to come next.
This is not the last pandemic or the last epidemic or outbreak we're going to face. There are probably going to be many more. And again, we can definitely learn lessons from this.
Dan Kerman, KRON 4 News.